Good morning, everybody. It's a pleasure and an honor to be here. Thank you, Suzanne, for setting this up. I'm going to talk about understanding liver disease in the setting of cancer, and I'm going to minimize medical terminology as much as possible and just give you all a general overview of what the liver does, how I think there were some very interesting questions on how drugs affect how medications, therapies affect the liver, and how the liver responds back. And so happy to field any of them and like to make this as informal and engaging as possible. This is the outline of what I'm going to talk about. What does the liver do? What causes liver issues and liver cancer? The types of liver cancer, I think some of my earlier colleagues touched upon this. I will talk more from the physiology standpoint and what happens when you have cancer arising from the liver as opposed to cancer coming from somewhere else and going into the liver. How does the cancer treatment affect a sick liver? How do we treat the sick liver? What can we do to make patients to stay healthy and comfortable? And certainly, I'd love to take questions. And I think Dr. Hembright talked about this somewhat. But from a medical standpoint, what does the liver do? Well, you might actually ask what it does not do, because it does a lot. Metabolism, the liver is the center of metabolism and digestion. So it is obviously a very vital organ. It purifies a lot of toxins, and when the liver is sick, a lot of toxins stick around in the body and cause a lot of symptoms. It is a major excretory organ. A lot of food products that are not needed, and the residue is all excreted by the liver into the bile and through the stools. It has a strong immune function. So when a liver gets sick, when patients develop cirrhosis, they by default have a lower immune system and are more prone to infection. So the liver has a very strong immune function. And of course, the processing of drugs, medications, majority of all medications that we take, and exclusively all the pills that we take, all go through the liver first. So therefore, this is very important. And of course, we'll address what sometimes medications can do to you and how the liver responds back. How do we measure liver function? I'm a liver specialist, so we employ a number of different techniques and tools to assess how well your liver is working or not working. We have some blood tests, which a lot of you may be familiar with. Your oncologist or your physician or your surgeon may be ordering. They talk about bilirubin a lot. So bilirubin is a breakdown of hemoglobin. And so we know the red cells have a finite life, and when they break down, they produce this chemical called bilirubin. And bilirubin is exclusively processed in the liver, and it is sent out into the bile, which colors the stool, which what makes the stool brown, and it's out of the system. If the liver is functioning very poorly, that is one of the things that goes up. The bilirubin goes up, which causes jaundice, yellow discoloration of your skin and the white coating of your eyes. There is albumin. Albumin is a protein that only the liver makes. There's no other organ in the body that makes it, and that's what's responsible for keeping all the fluid within our bloodstream. It kind of holds it together. So if you have less albumin, that means if your liver is functioning poorly, or sometimes if your nutrition is not good, then you can get swelling in your legs and fluid buildup in your belly and so on and so forth. Then there is clotting. The liver is the only organ in the body that makes majority of the clotting factors. So that's called as prothrombin time and INR. That's how we measure if somebody's blood is thin and if they're at a risk for bleeding. And then liver enzymes. I think somebody in the audience asked that their liver enzymes were 1,000. What does that mean? When the liver is injured or inflamed or swollen, the liver enzymes go up. And that's in general, that's called as hepatitis. And there's many different types of it. But in the context of cancer, the biggest thing we worry about is hepatitis caused by drugs, by medications. Then there is the creatinine, which is really, it's a function of the kidney, but the liver affects it a lot. The liver and the kidney work very closely with each other. So something that badly affects the liver can in turn affect the kidneys. They both excrete unwanted substances, and so we use creatinine also as an indirect measure of how the liver is doing. And for patients who have intrinsic liver disease or cirrhosis, we have these two computational algorithms called the child score and the MELD score, and we use them to determine if somebody with liver disease should undergo surgery, if they can safely undergo surgery without causing liver failure, and if somebody with cirrhosis and liver cancer can receive a transplant. And that's called as the MELD score. It tells us the chance of dying without getting a liver transplant. And this is primarily related to patients who have liver failure and not other cancers which go into the liver. So what causes liver disease and liver cancer? And I think I'd like to spend a little bit of time here, because I think there's, we have the fortune of having patients, their families here. Some of you may have liver cancer coming from the liver. A lot may have cancer which has spread to the liver from other organs. And the two things are very, very widely different, very, very different. And we approach them very differently. So when we look at primary liver cancer, which comes out from the liver, that's usually in the setting of a liver disease. A simple analogy is you may get breast cancer without having a disease in the breast, or prostate cancer without a problem in the prostate. But you will generally never get primary liver cancer without having a problem in your liver, meaning those patients who get primary liver cancer almost always have an underlying liver disease, and that's what makes it more complicated and challenging to treat. So what causes liver disease in the United States? The most common cause of liver disease currently is fatty liver. It's also called as NASH, non-alcoholic steatohepatitis, and that comes from diabetes and obesity. About 50 million Americans have fatty liver problems, and it is a risk factor for cancer. Chronic hepatitis C, those born between 1945 and 1965, there's about 5 million Americans who have it, and 1 million of those patients have cirrhosis, and about 8% of them develop cancer every year. So it's a huge public health burden, but fortunately now with the medications that we have for hepatitis C, we've been able to eradicate a big chunk of it from our country. And then heavy alcohol use. So how is heavy alcohol use defined? Because obviously alcohol is a part of our social culture. When the consumption of alcohol is more than 20 drinks a week for men and 10 drinks a week for women, because women have a lower level of an enzyme that metabolizes alcohol, for over 10 years, those patients are at risk for developing significant liver disease. So those are the three most common ones, and there's a whole bunch of other illnesses that can affect the liver. I think somebody was asking about colorectal cancer and chemotherapy, and I mentioned earlier that if you have colorectal cancer which goes to the liver, well, your liver should be healthy, and so you should be able to cut out parts of it and things like that. But keep in mind that a lot of the drugs used for colorectal cancer can actually cause liver disease and scar tissue development in the liver. So it may not be as healthy as we would have in other cancers like breast cancer and so on and so forth. So other less common diseases affecting Americans are those which are mediated by the immune system, or chronic hepatitis B, which we see a lot in Asians and those patients coming from sub-Saharan Africa. And then genetic diseases are also, we see those as well. So now I'm going to switch gears and diversify into what can cause primary liver cancer and obviously cancers which go from other organs into the liver. So all chronic liver diseases which cause cirrhosis can cause liver cancer. So the development of cirrhosis itself is a risk factor for developing primary liver cancer. In medical terms, it's also called as hepatocellular carcinoma. And the most common cause of this currently in the United States is chronic hepatitis C and alcoholic cirrhosis. But the amount of fatty liver that we see in our country, this is going to be the most common cause of primary liver cancer in the next 10 years or so. And then patients who have hepatitis B, that's one disease that can cause cancer even without cirrhosis. So we often see people from Asia, especially China and Taiwan, and those patients who come from sub-Saharan Africa that develop primary liver cancer at a young age without any chronic liver disease, and it can be quite devastating. So we have the clear distinction because it makes a big difference to the therapy that you can get or cannot get. And so we have the primary liver cancer, which is mostly hepatocellular carcinoma, that is 90% of the time, and then 10% of the time there are cancers in the bile ducts, which is called as cholangiocarcinoma, which is less common but really quite an ominous cancer to have. And then the secondary cancers, the liver is the most common site of any metastasis because it is the largest visceral organ, and the blood from everywhere goes to the liver for processing. And so cancers of the colon, of course, because all the blood that comes into the GI tract goes into the liver for processing, because the liver takes care of all the food products for digestion, and the colon sends all the blood to the liver for processing as well. So the most common site of metastasis from colon cancer is the liver. The lungs, the breast, and virtually any organ cancer can spread to the liver. Again, the fundamental differences are that when you have this primary liver cancer, you have a disease in the liver, and except for a few occasions where the rest of the liver is very healthy, surgery is limited, whereas in secondary liver cancers, if the rest of the liver is healthy and the cancer is confined to a part of the liver which can be safely removed, then surgery can be a better option. So those are the fundamental differences. But obviously, everybody is very different, and as mentioned earlier, we obviously personalize the treatment to every patient. So what does cancer treatment do to the sick liver? So if you already have a liver problem and you're getting cancer treatment, it could be for primary liver cancer or another cancer, what happens? Well, our goal is to make it better as physicians and surgeons, but we could make it worse, and that's an unwanted side effect. I think you talked about a chemotherapy called nivolumab, which causes in about 2% of patients a condition called autoimmune hepatitis, and makes the liver enzymes go up, and that's not what the physician intended to do, but that's a unwanted side effect. So cancer, because like I said, all drugs go through the liver for processing. Unwanted side effects can be seen in the liver. It can cause systemic toxicity, which is like chemotherapy. It can also cause liver failure. There are certain drugs which can potentially cause liver failure, and I see a lot of patients who are referred to monitor their liver function while they are getting chemotherapy or other treatments for different cancers. And then the liver disease may interact with medications that may be on board for the liver condition. So patients could be getting chemotherapy while we sometimes are treating their hepatitis C or giving them other treatments for the liver, and we have to keep a close eye on different medications because they can interact and sometimes cause problems as well. How can we treat the sick liver? So I said, by trade, I'm a liver specialist. So that's my job is to see what I can do to make the sick liver better. Sometimes we can make it significantly better. Like I said, hepatitis C, we have a cure now. We can, within 8 to 12 weeks, we can get rid of it completely. So it's a life-saving intervention. Hepatitis B, we have pills which can make the virus disappear forever. So it's not a cure, but if you take it for the rest of your life, it'll never come back. And those two diseases are relatively much more gratifying for us to treat because we can make them go away. We can stop it from getting worse. So half the time I spend is when patients come to me without obviously previous knowledge of what's happening with their liver or how the cancer's affecting them is mostly counseling. And I discuss things which sometimes seem like common knowledge and sometimes will not. For example, alcohol abstinence, especially in patients who have a undiagnosed but serious liver disease. A lot of times liver disease is very silent because the liver is a very robust organ. So sometimes you may have just 10% liver function left and may not know about it because you feel fine. And it's only when you go to see the liver specialist, I may say, well, this is what your tests indicate. And we spend a lot of time counseling patients on alcohol abstinence. Diabetes control is very important. Diabetes can really affect your liver very, very badly. And so when we have patients whose diabetes is not very well controlled, we attempt to do that to make their livers healthier. Symptom relief. So oftentimes patients with primary liver cancer and sometimes even from other cancers will have a lot of fluid accumulation, and that makes them very uncomfortable. They cannot eat very well, lose weight, feel short of breath. By just removing fluid, which is often done by our interventional radiologist and Dr. Shaheen, we can improve symptoms. There are pills which we give to remove fluid from the belly as well as the ankles, and that provides symptom relief as well. And there are a whole bunch of other medications that we give to improve symptoms from liver disease. And obviously, there's a lot of non-medical treatments involved. Oftentimes, I will send patients to our dietitian. Nutrition plays a key role in improving your liver function. Physical therapy is key as well. A lot of patients with cancers, and especially those with liver disease, are very, very deconditioned, and improving their physical conditioning gives them a tremendous sense of mental and physical well-being. And then counseling. A lot of times this is such a devastating illness that we often rely on our psychologist to provide counseling and supportive psychotherapy to our patients. We believe in patient empowerment, and certainly only part of what we do is what we do. I think a big part of what we do is what you do as patients, and that is really very important in our treatment paradigm. So what can you do as a patient if you have cancer and advanced liver disease? Avoiding alcohol and tobacco are key, and especially smoking. A lot of people don't, even after having cancer and all the press we have about how carcinogenic smoking is, it is still a very, very difficult habit to kick. And so I spend a lot of time counseling patients on tobacco cessation. Keeping well hydrated, people forget to drink water when they are taking such toxic therapy. So I counsel patients on keeping their own 64-ounce jar and at least consuming 8 glasses of water a day. Diet is very important, and a lot of patients are very misinformed. So if you have serious liver illnesses, either caused from the liver problem or from the cancer, we advocate a low sodium, which is about 2,000 milligrams of sodium a day diet, which is high in protein, and that is really key. It is hard. We often have to tell patients to eat multiple meals a day because they cannot eat a lot at one time, and really low in carb. Why low in carb? Because a lot of our patients are diabetic, and the carbs do not provide as much muscle mass as proteins do, and they're harder on your liver. Some simple medications are often, there's a lot of myth and misinformation about them, and 9 out of 10 times when patients come to me, they're saying that their physician told them to avoid Tylenol. Tylenol is the safest pain medication to take even if you have liver disease. It is the safest. You can If you have no liver disease or mild liver disease, you can take up to 8 tablets a day of extra strength Tylenol. If you have cirrhosis, you can still take up to 4 extra strength Tylenols a day. What medications do we avoid, especially if you have a serious liver problem, is non-steroidal. So medicines like Motrin, Advil, Aleve. Narcotics is obviously a problem. Now, we are very cognizant of patients with cancer. We want to provide pain relief. Obviously, that is a big part of what we do. However, we are facing a tremendous opioid epidemic in this country, and to avoid narcotics in patients who have cancer or minimize the use of them can be very helpful in improving your physical and mental well-being. As helpful narcotics are in patients who have very terminal pain, which would never want to withhold, they can be very detrimental to your overall mental and physical well-being. They cause a lot of GI problems, they cause a lot of mental fogginess, and just a natural slowdown, which we try to avoid to try and keep patients active. Again, sedatives, and we want patients to have a good night sleep, but there are a wide range of sedatives. We avoid the long-acting ones and give patients more short-acting ones. Physical activity is very important. The amount of endorphins you generate when you just go for a walk outside, despite the illness that you have, is important, as opposed to sitting at home and lying in bed because it just feels more comfortable to do that. And then stress reduction. I mean, a lot of this is obviously it has just such a tremendous letdown on your sense of mental well-being, that whatever we can do to reduce that and garner help from family, from your community, from your church, is really critical. Sometimes even more important than what we can do medically to improve your well-being.